It's Breaking the News Plus on this Tuesday night, and our focus is on the third largest company in these United States, United Health. It is by far the largest company in Minnesota, and we're going to talk about it as we have a lot over the last year and a half. But today, an earnings call, not something we normally jump on top of as a lead story in news, but they carry such significant weight here, and they've been under some serious significant scrutiny by both the Department of Justice and the public eye. To talk about it, a former insider in the healthcare industry and the president and CEO of Fulcrum Strategies, Ron Howrigan. Hey, Ron, thanks for joining us.
Oh, you're very welcome. Thanks for having me.
So today, United Health, its leaders get on their earnings call 45 minutes before investors get on, and they kind of strike a tone of humility. Was that to set the tone of more bad news, or what do you think from that?
Well, I think it was partly to set the tone of more bad news. I think it was partly this is on a string of a lot of bad news. And it felt a little bit to me almost like somebody who's been caught in doing something bad, and it's time to come clean and say, okay, I've been bad. It's time to do better.
Yeah, that news comes out last week as they finally admit to what the Wall Street Journal had been reporting for darn near 6 months, that they were under investigation by the Department of Justice. And it's interesting, too, I know that you were a part of that coverage for Breaking the News, that United Health had been saying, oh, Wall Street Journal, you have it wrong. You don't know what you're talking about, and being pretty aggressive with them. And now to say, oh, yeah, we're cooperating.
Yeah, that felt a little bit like somebody denying an accusation of something, and then suddenly there's video evidence of it, and then they go, oh, well, yeah, we are under investigation. They knew they were under investigation. They were just trying to make it go away.
A lot of things have been haunting United Health Group, United Healthcare, obviously, from the murder of Brian Thompson and after all the scrutiny coming to the healthcare industry as a whole. But let's talk about losses, revenue losses. They lost half their value in the last year. And why is that? Let's remind people.
Well, I think it's because, Wall Street has loved the performance of United Healthcare and many other payers as these constant, ever-growing profit machines. And there was a chink in that armor. Wall Street has now decided that maybe this isn't the place to put your money. And whenever that happens, Wall Street punishes that company. They've lost more than half their value, which shows that Wall Street's not really sure this is as big a profit driver as what it used to be. And that's largely, and they talked about it today, because medical expenses up. As many people put it, darn it, these people are actually using their insurance too much. And that's a bad thing for United.
Yeah, that's its own subject. I want to go back to the first thing you said, and then we'll jump back to it. That, once Wall Street sets its expectations, a coworker was, they're like, say it to me plain. I'm like, okay, if you overperform at work today, tomorrow that overperformance is your new bar. That's your new baseline. And basically that's what Wall Street was doing to United Health, right? I'm like, oh, you overperformed, so now we expect that at minimum, and now go overperform that over the years.
Yeah. It worked for a for-profit insurance company earlier, it's always, what can you do for me next quarter? And how can it be more than you did last quarter? That's a tough thing to live up to, but it's constant expectations of exceeding whatever last quarter or last year was.
And in order to do that, they have to get creative with math. Let's talk about what you were talking about that was basically admitted to. Oh, the people who signed up for Medicare Advantage are actually using the heck out of it, and so we have to do something. Is that fair to say?
Yeah, absolutely. They call it a medical loss ratio, which is the percentage of their premiums or their revenue that actually gets paid out for provision of care. And that's way up across the board for United and many of their competitors in the Medicare Advantage world. But that just means there's not as much money there for profit. And so that's why Wall Street starts to downgrade and people sell the stock.
So forgive me for sounding cynical, but if I am a customer, if I pay for Medicare Advantage through United Health or Humana or Blue Cross, I expect to use it when I want to, and that not be a problem.
Well, and this lies one of the fundamental problems with the way we do health insurance in this country. Almost every other company that's selling a product wants you to buy their product and use their product. Apple loves it when you buy a new iPhone. Ford loves it when you buy a new truck. United does not love it when you want to actually use that insurance and get health care. because that's an expense for them and a loss for them. That creates this problem of the more customers that use their product, the worse for them.
Publicly, they said on their call today, we want to be more focused on our customers. We want to be better. How does that square with what you just said?
There's part of me that hopes that they're being honest about that they are going to do better for customers. But you also have to listen to some of the other things they said on the call. They also then said things that they wanted to focus more on the inappropriate use of care, that they said they were going to step up their audit, clinical policy, and payment integrity tools to protect customers and patients from unnecessary cost. Well, that's insurance speak for we're going to start denying more claims. Okay, that's not good. They talked about shifting to narrower networks, focusing on more disciplined managed products, particularly in the Medicare Advantage. Narrow networks is insurance speak for they're going to terminate physicians out of their network, which gives less choice to the patients who use it. So, yes, on the front part of it, they talked about being a kinder, gentler, friendlier, more humble organization. But then later in the call, they really talked to the investors about this is how we're going to cut cost, which if you're the recipient of care, that means cutting care for you, or if you're a physician or hospital, it means cutting reimbursement.
And they're talking about also dropping some Medicare Advantage health plans, covering more than 600,000 people. That kind of falls in line with that whole lean and mean strategy that you're talking about that all big for-profit companies use.
Right. And that's a smart financial move, but there are patients tied to those plans who are going to get their plans yanked out from underneath them. And who knows whether they have other options. So it's one thing for any other industry to say, I'm going to get rid of unprofitable factories or lines of business. But these are healthcare. These are, Medicare Advantage people that rely on this, and they're going to lose their coverage just because it's not profitable for an insurance company to cover them anymore.
How can an individual that pays for coverage today lose it a year from now? Is that just how it works? They can just cancel a person's plan, or is it a little bit more in the weeds than that?
No, I mean, they're not obligated to offer that coverage for a long-term period of time. They can remove those plans. They can get out of that market or get out of that business, just like they're not obligated to have a complete and full network. They can terminate providers out of their network or hospitals. They will do that which helps make them profitable again. Unfortunately, the people who get hurt in that environment are usually patients or physicians.
Yeah, you and I talked about that a bit as we were exchanging messages, and there's like an indirect way to get people off of a healthcare plan, right? Like, say, if they take the doctors that patient needs, if they have some sort of specialized care, and those are all of a sudden become out of network, next year, you kind of, the patient then has a choice to make. Like, well, I'm not going to pay out of network, and my only other option is to stay, get new doctors. That could take time, or leave and start all over.
Yeah, that's exactly it. I mean, there's a physician shortage in a lot of areas and in a lot of specialties. And there are some specialties that, by the nature of the specialty, have chronic, very expensive patients. Rheumatology, oncology, neurology. These are patients with diseases that are long-term, expensive, and chronic, so they need their insurance. So if I'm an insurance company and I terminate a rheumatologist, their patients might not be able to find another doctor that will care for them in any time soon. Could be 6 months before they can get into another doctor, and they need care during that time. So the only other option is to leave United Healthcare and join a different MA plan. Well, that's okay, except that that's exactly what United wants, because they lose an expensive member. And then when that member goes to another insurance company, let's say Humana or Blue Cross, it provides an incentive for that insurance company to then go ahead and also terminate these specialty physicians, because they don't want that additional sick population. And it's a vicious cycle, and the patients get caught in the middle.
So what does that say about the industry as a whole, where a person that is using their health care often because they need to, because they're sick through no fault of their own, gets bounced around?
Yeah, and you hit on something really important. Through no fault of their own. People don't choose to get MS or Parkinson's disease or rheumatic arthritis. These are conditions that or cancer, and then you need the insurance more than ever. but you're the very type of consumer that these insurance companies don't want and want to get rid of. And so it puts that patient in a horrible situation. The person who needs their insurance the most is the one who is least likely to be able to access it.
And I've heard this, from friends that I've had over the years with terminal illnesses, talk about this whole idea where you pay into a system. Okay, so they were working for 20 years before they did so much as use it for more than an annual exam or maybe a strep throat here and there with a kid. You pay in 20 years, the same amount, and then on year 21, you get a significant illness, and so you use more of it. And they're just asking, well, doesn't that even out?
It would even out if sort of there was a level playing field. So if every insurance company had to take anybody who wanted to buy their product, okay, then there would probably be an evening of risk. But they don't have to take everybody, and they can use these tactics like getting rid of physicians who attract sicker patients because of their specialty to sort of get those sicker patients off to one of their competitors. The insurance industry calls that adverse selection, when I get too many of the very sick people. And there's strategies that they can use, a lot of strategies, to try to avoid or get rid of those people. It's one of the reasons why they do prior auth. If I'm an insurance company and I make it harder for, and I'm picking a specialty, an MS patient, to get the care they need, they're going to gravitate to another insurance company, and I'm going to get rid of an expensive patient. So since the patients aren't protected in any sort of level playing field to keep away from these strategies, those strategies are utilized a lot and have been for a long time.
I ask you this every time I talk to you, Ron, because every time I talk to you, my blood pressure rises and it makes me need to use my health care that I pay for out of my paycheck. But I don't understand how a system like this can get fixed when we live in a country that wants profits, and we live in a country where profits have been given to investors of this company and other companies. How do we fix health care and so it works for both the provider of the insurance and the people who work there and the patients who pay for it?
Well, I think fundamentally, one of the advantages of our type of system in a capitalistic environment is you get exactly what, will produce more profits. There's a reason why certain products get better and better, because that makes more money. We just have to change what the profit incentive is. If these insurance companies actually made profit by keeping you healthy, or as quickly as possible fixing your disease, or making their patients and physicians happy, if that was where they made profit, that's exactly what they do. Unfortunately, the system now says they make profit by avoiding sickness, by denying claims, by getting rid of expensive people and pushing them off somewhere. That's where their profit motivation is. We've got to change what is winning for them. Once we do that, they'll fix it themselves. Either that, or we've got to have a complete sort of legislative overhaul of the whole thing. As long as United Healthcare and everybody else, Cigna and Aetna, can make money by denying care and avoiding sick people, they're going to.
So what's the answer to that first, more hopeful scenario that we did incentivize getting patients as healthy as possible? Who would incentivize them?
I think it's got to be at least some form of government regulation to change what it is and what you can do, how you can do it, and how you make money doing it. I think the other half is, and I think we're getting there, is societal pressure. The employers have to say, no, this isn't it. The voters have to say, this isn't it. We don't like companies who do this, who create this damage to the patients who need it the most. So I think it's a combination of some legislative change and some societal push and change to it. I think the societal change is we're starting to feel it. Otherwise, they wouldn't have talked about, being I think they said a tone of change and reform born out of our mission to help people who live healthier lives. They're saying the right things. Now we just need to make them do the right things.
Right. And I mean, as a cynic turned journalist, or both, once you say those things out loud, then you should be held accountable to them by your customers.
Yes. But also remember, in healthcare, the customer or the consumer, the patient, is not the purchaser. The government or the employer is the purchaser. So both those entities need to start to holding them to a higher standard. Employers who use United Healthcare need to say, you need to start doing different things. The government who pays them for Medicare Advantage needs to say, you need to do different things. We're only going to pay you to do the things we want you to do.
Okay. Well, Ron Howrigan, it's always insightful, gives us a lot to think about, and about 20 more ideas for conversations to have. I appreciate being on tonight.
Sounds good. Thank you.
Thanks. That's all for Breaking the News on this Tuesday night. We'll see you tomorrow. Take care.